Reaching overhead is a basic functional motion that we all do each day, and typically without even thinking about it. Until it hurts, then it's an issue. Odds are if you're watching this video, you've experienced this in the past, or someone you know has experienced this. I know I have personally. And when it happens, it's frustrating, it's annoying. So what can we do about it? By the end of this video, you'll understand some things that could cause your pain, what you can do to address it, and how you can get back to your normal function. Hi, my name is Kevin Coleman. I'm a physical therapist and clinic director with EW Motion Therapy. I've been practicing for a little over 10 years now, and on a daily basis, I treat patients with shoulder pain, and that typically involves decreasing pain and restoring range of motion. Today, I want to review what can cause your shoulder pain, how you can decrease your pain, and how PT can help. So, what can cause your shoulder pain? Well, there's 4 common diagnoses that we as physical therapists see. 1 is impingement, 2 is bursitis, 3 is a rotator cuff strain, and 4 is a frozen shoulder. Let's start with impingement. Impingement is typically an overuse type injury in the shoulder. It often occurs over time. Things such as poor posture, muscle imbalances where the muscles in the front of your shoulder become too tight, muscles in the back of the shoulder become too weak, create an imbalance to where the shoulder can't function like it normally does. That can lead to impingement where the soft tissues in the shoulder, such as a tendon, begins to pinch and get irritated and lead to inflammation, which can cause pain. Bursitis is very similar to impingement. It's just a different structure involved. Your bursa is a little fluid-filled sac. You have multiple in the shoulder. They act as shock and friction absorbers in the shoulder, but they can also become irritated, inflamed, and can cause pain. Clinically, it's difficult sometimes to distinguish between the two without imaging, but it's treated relatively the same. Another issue in the shoulder could be a rotator cuff strain or tear. A strain really that refers to a tendon. The tendon has been stressed and it's become irritated. So your rotator cuff consists of 4 muscles. The tendons in those 4 muscles form your rotator cuff. So a tear, could be slight, moderate, or severe. That refers to the actual tendon that forms around the rotator cuff. And another cause of shoulder pain could be frozen shoulder. Now, of these that I've mentioned, frozen shoulder is probably the least understood because sometimes it can happen without cause, without injury. The other things that I mentioned, impingement, rotator cuff strain, if you've had those injuries in the past, that could contribute to a frozen shoulder happening down the road. So let's talk about some ways that you can reduce your shoulder pain. First of all, if you're performing a repetitive activity, let's say throwing a baseball, and that's contributing to your pain, we want to decrease or probably cut that out to allow your shoulder to recover. Another thing we can do are pain medications, over-the-counter, NSAIDs, your anti-inflammatories, that can help. Ice on the shoulder can help 15 to 20 minutes at a time. Oftentimes with pain, you'll have tightness in the muscles in your neck, some heat on your neck, again, 15 to 20 minutes, that can help as well. If you've tried these methods and your pain's staying the same, you're not getting any better, you're having pain that continues for 2 to 3 days, it's probably time to see your doctor. And they may prescribe a stronger medication, they may recommend a steroid injection, or prescribe physical therapy. So if your physician recommends physical therapy, let's talk about some ways physical therapy can help. First, your physical therapist is going to perform an initial evaluation where we get to know you, we get an understanding of the nature of your injury. Is it acute? Is it a chronic type injury? And establish a course of action or a plan of care that's specific to you, your injury. As far as physical therapy treatment, typically there's 4 areas that are going to be addressed. First is your pain. We've got to get that under control. 2 is restoring your range of motion. 3 is restoring your strength. And then 4 is restoring functional movement, such as with that overhead reach that was painful. Oftentimes throughout your course of treatment with a physical therapist, they'll give you a home exercise program that starts out pretty basic and then progresses as you progress. And oftentimes We'll recommend you to continue doing that after you discharge, especially if there's something such as your posture that's related to an overuse type syndrome, such as shoulder impingement. So I hope you have a better understanding of shoulder pain and some things you can do to address it. I did mention frozen shoulder. It's a diagnosis that we see often. It is tricky. We do get a lot of questions about it. So if you're looking for information on frozen shoulder, see the link in our description below on how PT can address that.
If you found this video helpful, be sure to give it a thumbs up and don't forget to subscribe to our YouTube channel to help you on your physical therapy and wellness journey.